due to decrease in sodium ion. Lack of sodium ion will also affect the sodium bicarbonate buffer and will lead to acidosis. To reduce acidosis also, we can use area androgens. Function is very, very less. Precursor sex hormone indicates puberty and growth. Next, adrenal medulla. Adrenal medulla, you are epinephrine, norepinephrine, releases adrenaline, noradrenaline. We use left sweat and right sweat, you know pretty well about these things. The adrenal medulla secretes adrenaline and noradrenaline. These two substances are also liberated from sympathetic nerves. Functions of adrenal medulla. Adrenaline and noradrenaline potentiate the fight or flight response at initial sympathetic stimulation by increasing heart rate, increasing blood pressure, increasing metabolic rate, dilating pupils, diverting blood to essential organs, including the heart, brain, and skeletal muscles by dilating the blood vessels and constricting those of less essential organs, example skin. Element stimulation methods. In LMT, adrenal cortex stimulated by area treatment, adrenal medulla is stimulated by treatment. The unique findings are following. Right adrenal produces 80% norepinephrine and 20% epinephrine. Like that, left adrenal gland produces 80% epinephrine and 20% norepinephrine. Three kinds of stimulation in adrenal medulla. Sweat, it stimulates both adrenal medulla. Left sweat, it stimulates the left adrenal medulla for epinephrine. Right sweat, it stimulates the right adrenal medulla for norepinephrine.
Saviku Namaskar. Let us see sweat NT practical point demonstrate.
Treating asthma. This is also today after I have here described very clearly. Just 1.5. Six left sweat is given to stimulate epinephrine for what? To dilate fever. To dilate.
एक बार आपके जो जालमान है उनको बुला ले जाओ ना इनको तो खिलाओ
That is what dilate. Treating varicose veins. In varicose veins, the blood vessels are dilated so that the walls are distended and fail to prevent backflow of blood. So, to constrict the blood vessels, we give 6 right sweat. Is that clear? Reason is not containing it. Users of left sweat. Logic. This is used when we wish to dilate any pincer, wall, or tube of the body. Treating what is stenosis? For narrowing, right? For a person with difficulty in swallowing due to constriction of the esophagus, for a person with stricture or narrowing in the urethra, as a result of which the urine comes out with very great force and with burning pain during ejaculation. It may be benefit patients with prostate gland enlargement also, where the urine comes out in drop with great difficulty. Do not give to diabetic person. The reason is the treatment stimulates epinephrine. Epinephrine rises blood sugar level. So do not give this treatment to diabetic. Users of this right sweat logic. This is used when you wish to constrict any sphincter, wall, or tube of the body. Useful in bronchitis where the person has difficulty in exhalation. In some persons, such as ladies and gay persons, few drops of urine may come out uncontrollably when they squeeze, cough, or laugh loudly. This is because their urinary sphincter muscles are too weak. We have right sweat problem. This treatment constricts the sphincter and the patient gets immediate relief. Do not use the IVP patient. Reason is this treatment stimulates norepinephrine, so do not use the patient of IVP. Avoid area IVP patient. Reason. Two areas will stimulate the production of aldosterone, which will cause kidneys to retain salt and water, which will aggravate IVP. 6 areas reduce the acidosis and may increase alkali because IVP is a disease of alkalosis. Avoid area of cancer patients also. Reason. 4 areas will increase the blood sugar because it will give energy to the cancer cells and cause their proliferation. What is proliferation? What is proliferation? Multiplication. It will multiply.
लाइक तो करो,
Fixed area reduces immunity. The adrenal cortex inhibits the thymus. In this disease, we have to strengthen immunity, not the weaken it. Avoid areas running up. Do not know very well about this. Fixed area reduces acidosis and is useful to open the block mode, so it will accelerate running mode.
काय की वीडियो बनाया
यूट्यूब पे
Avoid
लाइक
areas for infectious
Live.
diseases. Fixed area
मैं Facebook पे live चलाऊं।
and will accelerate infectious disorder. So, not.
देखिए चल रहा बना रहे।
Septicemia. What is
Like a
septicemia? This is a condition indicating abnormal increase of bacteria in the blood due to low immunity. If we give area, it will suppress the thymus gland and will further decrease the body immunity. If we give 6 area by mistake, the patient will go into convulsion. Such patients should be given thymus plus this viral treatment for night. Avoid area diabetes patient. Already we have said. We have seen the practical specifically T6 to T12. Why specifically we have to give treatment that are being in all T6 and T12? Let us see the logic. The adrenal glands are not just sitting there randomly above the kidney, they are wired into your nervous system, and that's where the connection with T6 T12 comes in. Connection between T6 T12 and the adrenal glands.
आएंगे व्यूज आएंगे भाई।
Nerve supply, sympathetic nerve.
मैं कह रहा हूँ
The adrenal glands
इनके
are
chairperson को भी कुछ नहीं समझ
controlled
आता।
by the sympathetic nerve system. You know all very well. Nerves
कुछ
from
कहेंगे?
the thoracic spinal cord
भाई
segment
वो क्या है, उंगलियां से सारे करवा
travel
दें
through the carotid nerves and connect to the stereo.
ऐसे में ना
From that, fibers go to the
आदमी
adrenal medulla.
मुझे उधर जाते हैं।
Adrenal carotid. It is in inner part. It goes. The adrenal medulla is special because it acts almost like a modified synthetic ganglion. Instead of passing signals onto another nerve, it directly releases adrenaline and noradrenaline into the blood. Keep it. Note this point. Instead of passing signals onto another nerve, it directly releases adrenaline and noradrenaline into the blood.
थोड़ा और क्लोज कर
Functional meaning. When the spinal cord P6T12 sends a stress signal, the adrenal gland instantly release adrenaline. Instantly. That's how
ये senior neurotherapy देवेंद्र शर्मा।
response in
ये सारा
millisecond. In the millisecond itself,
ये हमारे
we are getting that
पाठक सर और आदरणीय सभी न्यूरोथेरेपिस्ट आज दिल्ली राजघाट में हमारा न्यूरोथेरेपी का सेमिनार चल रहा है गांधी समिति में, आप देख सकते हैं सैकड़ों लोगों ने इस सेमिनार में भाग लिया है और अपने अपने ज्ञान को साझा करते हुए आप देख रहे हैं हमारे सीनियर न्यूरोथेरेपिस्ट। 2 दशकों का इनको अनुभव है न्यूरोथेरेपी का और लोगों को समझाते हुए बताते हुए न्यूरोथेरेपी प्रैक्टिकल पॉइंट्स के बारे में अपने ज्ञान को लोगों में बांटते हुए
It requires application of strong pressure, not like rubbing. Rubbing is not enough. That is, it may be.
आर त्यागराजन जी
That is why Guruji.
चेन्नई से हैं, बहुत अच्छा ज्ञान है न्यूरोथेरेपी का और आप देख सकते हैं इस वीडियो के माध्यम से लोगों को अपने ज्ञान का वर्णन इस प्रकार बता रहे हैं जैसे बहुत बेहतरीन थेरेपी न्यूरोथेरेपी है। और आज हमारे परम पूजनीय गुरु जी डॉक्टर मेहरा जी का बर्थडे है, उसी के उपलक्ष्य में हमने ये सेमिनार रखा है जिसमें बढ़ चढ़कर न्यूरोथेरेपिस्ट सभी हमारे भाई बंधुओं ने भाग लिया, आप देख सकते हैं।
So more stimulation will be required for the inner layer. That is why more stimulation. 6 8 like that. Thank you.
भाई कह रहा हूँ नहीं पानी लेके लेट जाओ अगर